All right, let's get started. All right, so the article is entitled "The Biomechanics of Neck Injuries Resulting from Rear End Collisions." Do you have a copy of this?
I do not think I do.
All right, so check your email from Eric, please.
I'll send it over immediately.
All right, check your email. We'll get this going to you. This is the top 10 one. You're going to keep it handy. You're going to use it a lot.
Okay.
This is from the journal Turk Neurosurgery. So, all right, that's Kevin. Turk Neurosurgery, and this is from Dr. Dennis Erbelet from the Koç University School of Medicine, Department of Mechanical Engineering and Neurosurgery in Istanbul, Turkey. All right, key points. 85% of the neck injuries caused by car accidents as a result of rear end collisions. X-rays and MRI have a limited ability to diagnose whiplash injuries. Whiplash injuries are difficult to diagnose using methods such as basic radiography and MRI. So we've already established that up to 40, even 60%, some references say injuries are missed in whiplash. That's why you have you've been in practice here for a while. You've had those patients, they've been under care, some of the doctors around, they're still hurting because no one's actually figured out what the actual problem is, because some of the imaging doesn't work. We'll go, if we haven't discussed that article with you personally, we'll hit it in one of our classes because that's super important. Whiplash injuries can cause long-term neck pain and limitation of movement. Whiplash injuries can be seen even in low-speed rear-end collisions and are generally dangerous for the driver and the passenger in the front seat. This is a key point here. During the whiplash mechanism, the velocity change is rather small, right? 5 to 10 miles an hour, but the rate of this velocity change is very short, a high value acceleration. The short rate of velocity change increases injury. The entire sequence of an extension flexion was completed within 0.5 seconds of impact. Therefore, even low-speed rear-end collisions may generate substantial forces and result in significant injuries. This is documented in a book called Painful Cervical Trauma, but published in 1992 by Tessel and McLean. The key to this is the time, all right? Because it's about the acceleration. If you're in an airplane and you fly that airplane and land in Logan Airport, your change of velocity is really big. It's 600 miles an hour. You're going from 600 miles an hour flying to 0. Now, Mary, did you get hurt when that happened?
No.
Of course not. All right, because the rate of change to the speed was very slow. Now, if you're taking that same plane and you fly it into a mountain, what's the difference?
It's the sudden stop.
Stop, exactly. All right. So the sudden stop is what hurts you because it's change velocity by time. So if the time is small, it creates a lot of force. 5 miles per hour is the threshold value for whiplash injuries caused by rear end collisions. Whiplash injuries start with the speed value of 5 miles per hour, and the severity increases accordingly as the level of speed increases. Now, another key point here. The acceleration of the body of the passenger is quite different from the acceleration of the car. The acceleration of the head is about 2 to 2.5 times greater than the acceleration of the vehicle. It has been established for decades that an 8-mile-an-hour same-size vehicle collision causes a 2g acceleration of the struck vehicle and a 5g acceleration of the occupant's head. And this is out of White and Punjabi, the Bible of Spinal Biomechanics. This unique injuring principle is known as the magnification of acceleration. All right. According to statistical data, the speed of the impact, the headrest of the seat, position of the passenger, material of the seat, and design of the seat all affect the intensity of the whiplash injury. Now, one of the key factors with our folks is the headrest. All right, the headrest is probably the most effective piece of equipment in a car crash to protect you. It actually prevents injuries, unlike a seatbelt, which changes injuries, unlike an airbag, which can actually injure you or changes injuries. But the headrest is the one thing that prevents injury. But the key is it only works if your head's within 1/4 inch of the headrest upon impact. Now, You just had to stand in front of my office on Charles Street and see the people driving around, and they're all like that. All right, and their head is, inches, if not feet, away from the headrest. One of my favorite pictures of my classes, I had this picture of an Uber guy, and the headrest is literally 1.5 feet away from his head. He had the seat way back, and he's sitting right up, literally 1.5 feet. The other issue is headrest. How high is it? All right, if your headrest is too low, when the first thing that happens is the car slides onto the driver and the body comes up. So if your headrest is low, it actually creates a fulcrum and actually make the whiplash injury worse. Number 9, whiplash injuries are unavoidable in rear end accidents that generate at least 7 kilograms of acceleration. 7 Gs of acceleration. The position of the passenger is another factor. Passengers in the front seat had a greater risk of whiplash injuries than does a person in the back seat. An important injury reversing factor is the headrest. All right, seat's headrest. Most headrests are not adjusted to effectively prevent injury. The distance between the headrest and the head plays a vital role in inducing whiplash injury. To reduce the risk of injury, the distance between the headrest and the head must be no greater than 10 millimeters, less than ½ inch, and ideally should be less than ¼ inch or 6 millimeters. Headrests that are not adjusted properly and too far away from the head cannot prevent whiplash injuries. The severity of injuries may vary accordingly, not only with the acceleration caused by the collision, but also the mechanical structure of the car. Now, another key point. Whiplash injuries have increased in number since car seats have been strengthened mechanically. So, do you guys have the article now?
Let me take a look.
Oh, you got it?
I'm going to take a peek now. Let's see.
Well, in the article, they show a picture of what happened in the old days when you got in a whiplash many times. The seat back would break. So you'd end up in the back seat after a car crash. Right? The seat would literally break and fold right down.
Yeah.
All right. So it shows a great picture of that in the article. Got it now, Mayor?
I do. Got it right up in front of me.
Kevin, how about you?
Did you email it?
Yes.
Okay, I don't see it yet, but
All right. It's on its way.
okay.
All right. Next, during the whiplash mechanism, the head moves backwards directly in the first 50 milliseconds. Between 50 and 75 milliseconds, the cervical spine takes the shape of an S. This is where the injury occurs. The upper part of the cervical spine flexes, while the lower part extends. During a rear impact, as the thorax is pushed forward, the lower part of the cervical spine experiences extension, whereas the upper part experiences flexion. The lower part of the cervical spine and the head extend during the periods of 75 to 100 milliseconds. Whiplash injuries occur when the cervical spine takes the shape of an S. The cervical spine becomes an S at about 50 milliseconds after impact. When the spine has the shape of an S, the posterior part of the lower cervical spine is exposed to compression, and the anterior part of the lower cervical spine is exposed to tension. When the situation exceeds the limits of the normal spine, it causes soft tissue injury. Where does the whiplash injury occur? Possible injury sites may include the facet joint. That's number 1. All right, 60% of your cervical spine injuries are going to be to the facet joint. 60% or more, actually. I mean, some references say 70%. The intervertebral disc, that's probably second. So you're looking at facet first, 60 to 70%. The intervertebral disc, 20 to 30%. Now the ligaments, they get injured when you get the facet injury. So they're sort of part and parcel to the first part. The spinal cord, the muscle, and the dorsal nerve roots. Experimental evidence has shown the tension in the facet joint tissue emerges before the head touches the headrest. The permanent site of injury is the facet joint. The compression of the back part of the there is compression in the back part of the facet joint. Facet joints show excessive linear gliding backwards movement, which is the cause of damage on the facet joint and the whiplash injury. Neck injury occurs in the first 100 milliseconds of a rear impact and is based on relative acceleration and velocity between the head and the torso. Biomechanical studies demonstrate that the cervical spine undergoes soft tissue injuries during the rear end collisions. Sigmoid deformation, which is the S, occurs just after the impact in the first 50 milliseconds. In this S-curve deformation phase, the facet joints of the lower cervical spine exceed normal physiological limits. The posterior part of the facet is exposed to compression, and the anterior part of the facet is exposed to tension. So, summary points. All right, the vast majority of the whiplash injuries occur from rear-end collisions. Either MRIs or X-rays are optimal for diagnosing whiplash soft tissue injuries. There appears to be a consensus argument that collision speeds of 5 miles an hour are capable of reducing whiplash soft tissue injuries. Whiplash soft tissue injuries occur during the non-physiological S curve of the cervical spine. Whiplash soft tissue injuries occur very quickly following vehicle contact, lasting between 1/20th to 1/10th of a second, or 0.5 to 0.1 seconds. And head restraints can mitigate whiplash soft tissue injuries, but ideally they should be less than 1/4 inch behind the head and should not be greater than 1/2 inch behind the head. Questions?
Okay. Yeah, definitely. Before I get the article, I think you said that front seat passengers actually had more injury than back seat passengers.
That's correct.
Okay.
That doesn't mean it's not possible to get hurt in the backseat. But
Yeah,
more likely
because I'm
to get hurt in
thinking
the
a lot of, older, even not so old cars, don't have headrests in the back.
Correct.
So is that kind of based upon that a newer car that has the headrests or not? It just seems kind of odd.
Well, part of the in the old days, you probably evened out, because a lot of old cars don't have those headrests back there. And the newer ones, they have like those little bumpy ones. It's sort of like a, it's like half a front seat headrest.
Yeah.
Typically, you're sitting further down in the seat. I find in the back seat, unless you're probably over my height. If you're 6 foot tall, you're probably really over it. But typically that's what the literature shows, that the front seat people are going to be more vulnerable.
Okay.
Good. Kevin, any questions?
I thought I had one earlier. I'm trying to remember what it was. But I guess I'm good. I'll look for that email. And what's an attachment? Yeah?
Yeah. So in the introduction, I talked about how this is an article you want to keep in your easy access drawer. And this is one that's going to apply to a lot of your cases. Obviously, rear impacts are a huge part of your practice. They happen so gosh darn often. I mean, I've been rear-ended like 6 times, I think. That's why I need to see my chiropractor on a regular basis. Yeah, the worst one I have is it was rear-ended by a Fiero back in like 1985. My car died in the middle of a relatively busy road, and the guy just slammed into me. I was like, oh, too bad I didn't know anything about this stuff now. I could have had a good settlement. When you're young, you don't think about those things.
So you talked about the lower threshold for whiplash injuries being 5 miles an hour. Do they top out like at 15 miles, 20 miles an hour, that kind of injury?
That's a really good question. I don't know if they top out, but what happens is as you get into higher speeds, the car dissipates more of the impact. You're familiar with crumple zones, you're familiar with, bumpers. The car deforms more. So there's certain stories you've seen, people falling out of buildings, falling on top of their car, and they survive because the car absorbed the impact. So your whiplash type injuries, the most common ones are going to be the lower impact ones. There's a lot of research out there that shows that the more the car breaks, the less injury there is.
Yeah, that's interesting because adjusters seem to take it the other way around, like, oh, there's no damage, couldn't be an injury. But then you have a case with a larger damage. Like I have a guy now who's probably impacted about 30 miles an hour from the rear. And, lots of car damage. Car was total. But he wasn't so severely injured. But anyways, if you have the photographs and so forth, I think what they look at is that, oh, that could be a good jury exhibit, and therefore maybe the value of the case should be higher. So they kind of play both ends. Right.
As the old adage goes, whoever has the best pictures wins, in a jury trial. But the fact is, the literature says it's different.
Well, that's why you need experts, I suppose, right?
Yeah, definitely.
That's a good point. Good point. Yeah, it's sort of, it's counterintuitive. You know, but it's a great article. It's in my book. It's from Japan, and it talks about the level of injury and compares the level of injury and hospitalization over the different amounts of car damage. And they show that the people in the first category with the least car damage were just as injured as the people in the highest category. So it was like high on the ends and then came down in the middle. It was like you. It's a look at my book. It's like the last article in the low impact section. I can't remember the guy's name off the top of my head. Yep.
You know, I think I might have a copy, but if I don't, you can get it on Amazon too, right?
Yeah.
Okay, all right, I'll check. I'll look around for mine.
Yeah, it's a great study. Again, it should be it's one of those top 10 ones you want to have handy. Good question. Anything else, guys?
I got more homework. That's about it.
Yeah. Dr. Quigley,
Yeah.
I don't have your book at this point.
Really?
Would you be willing to share that Japan study article with me?
I find it hard to believe you don't have my book.
I don't think so.
All right, I'll put it up here. Here we go. All right, this is car damage. There's no relationship between the severity of a collision and the disability. In a fascinating research project in the 2001 Archives of Orthopedic Trauma and Surgery by Hijoka et al. Found many important findings. They studied the risk of factors of long-term treatment of 400 patients with whiplash injury in Japan. The first finding, there was no relationship between vehicle damage and required treatment. I've reproduced the findings in this chart. So grade 0 through 5. Grade 0 was no damage. Grade 1 was slight damage. Grade 2 was bumper damage. Grade 3 was 1/3 of car damage. Grade 4 was half a car damage. And grade 5 was total destruction of the car. So average duration of treatment in grade 0, no damage, was 110 days. In the slight damage one, it was 80 days. Bumper damage, 80 days. Grade 3, 1/3 damage, 80 days. Grade 4, half a car damage, 110 days. So it took all the way to grade 4 to get back up to where it was at the beginning, and total destruction car was 100 days. Now, another good thing to do in this one is they talk about age group. All right. So they graded people decades from 20s, 30s, 40s, 50s. All right. And they found that the younger than 20 years had an average of 53 days of treatment, 20 to 29, 73 days, 30 to 39, 94 days, 40 to 49, 93 days, 99 days, 50 to 59, 99, and 60 to 69, 80 days. Now, this is an article, I think did we do that article? We did. It said that moderate degeneration was much worse for you than severe degeneration or no degeneration. And the fact is, when you have a lot of arthritis and a lot of degeneration, the joint, everything's going to be locked up to begin with. So you're not going to get that whiplash injury as badly as you would if you had moderate damage, moderate pre-existing arthritis. And obviously, if no arthritis, you're going to get better faster as well. But it was interesting that the moderate people, the people in the middle, tended to get hurt more than the people who are really severely arthritic and the young people. All right. Combining whiplash injury with degenerative changes such as osteoarthritis and spondylosis hinders early recovery from the damage. Between patients treated as outpatients and those admitted to a hospital, there's no difference in sex, age, or degree damage to the car. Zero damage to the vehicle patients require more treatment because the force is direct to the cervical spine and not the vehicle, which brings us back to the skiing story. When the car absorbs the crash energy and gets squashed, it decreases the rate of slowing your body down in the car accident. So really good stuff. That's like real good meat and potatoes kind of stuff. All right, guys, any other questions?
No,
We're good.
we're good.
So that was, what page was that? Give you the page number in the book. Page 48. All right, then, guys. So we'll be back in 2 weeks. So we'll come up with a new article and
Sounds perfect.
we'll have at it again.
All right.
Sounds
Thanks a lot.
great. Thank you.